Hi, my name is Dr. Nick Meyer. I practice holistic biological dentistry in Scottsdale, Arizona. Been in practice now over 4 decades. And what I'm wanting to share with you at this point is the meeting that's taking place with the American College for Advanced Medicine in ACAM. It's actually a joint meeting with the American Academy of Physiological Medicine and Dentistry, which is an airway group, breathing wellness, and then the AAOSH, it's the American Academy of Oral Systemic Health, which is the connection of the mouth to the health of the body, particularly looking through the lens of microbes and inflammation. The thing that's so fascinating to me is that these organizations have just been sprouting up over the last 10 years. And my book that I created 3 years ago talks about each one of these as how they relate together. So rather than having just a standalone organization talking about airway health, which is very important, and we're talking about chelation for heavy metal detoxification, very important, getting that stuff out of your body. And then the other one is mentioned the oral systemic health, which is the interrelationship of the health of the gum tissue with the ability of the mouth to inoculate bacteria into the rest of the body, and can take up residence in the heart, in your joints, in your brain, anywhere blood can go. You can have, and we do find microbes that are originating in the mouth. So that organizational construct for that meeting, there's these 3 separate meetings, but they're inextricably linked because they are looking through different windows to get to the why are people sick, how we can deal with them. And I look at this as it's a evolutionary / revolutionary happening for all the people that are out in the world of progressive medicine, progressive dentistry, that we have an opportunity to share the ideas about this and start to look at the other people's works. That was in part my journey, going to a lot of different alternative medicine conferences, hanging around with the high level doctors in Arizona here, doing chelation therapy. One of the doctors was the father of modern chelation therapy, Dr. Garry Gordon, wrote the protocols for ACAM dozens of years ago. Anyway, the other doctors are looking at different components, different parts, but I think we really need to ratchet it up 1 or 2 more levels and bring it all together and have a marvelous way to look at this, because it's a big problem, and our culture, the people of our world, are getting sicker because of the kinds of things which are befalling us. We have more toxins in our air, not just the kinds of things that are fillings in the body. We have restricted arches, we have poor nutrition, which give restricted arches, which feed the whole airway thing. When we have airway phenomenon problems, we have issues with turbulence, which affects the health of the tissues in the mouth, which feeds the production, for instance, nitric oxide, which feeds from the oral microbiome, feeds the whole GI system and that part of our body's well-being for that type of signaling molecule that's going through the whole body. So these things, if we really step back and get away from what happened to medicine many years ago, in the early, I think, 1920s, medicine was dissected apart. And we have GI doctors, we have which is a stomach doctor, we have a bowel doctor, kidney doctor, brain doctor, teeth doctors. We really need to bring all these pieces back together and have an appreciation of all these different component parts, because they do work together, they do talk together. And what we do in the mouth in dentistry does matter. The things that we do and use does matter in the overall health and well-being of an individual. So that's my story. I'm sticking to it. This is Nick Meyer from Scottsdale, Arizona.